When should one go to primary care, urgent care, or the emergency department? At the end of this section, you should be able to differentiate at least one characteristic between a primary care provider, a PCP, an urgent care, and an emergency department, an ED. Let's talk about a primary care provider, also known as a PCP. Healthcare.gov says a PCP is a physician, an MD medical doctor, or a DO, doctor of osteopathic medicine, nurse practitioner, clinical nurse specialist, or a physician assistant as allowed under state law who provides, coordinates, or helps a patient access a range of healthcare services. PCPs are the primary pathway to navigate the healthcare field. For many people, your PCP is the first person you see when you are sick. PCPs know your health best if you see them regularly. Since most people have the same PCP for years, they know you, your health, and your preferences best. They may also see your entire family and know your family health history and similarities in family members' healths. PCPs can also refer you to specialists when needed. Insurance may want you to see a PCP first. Check with your insurance for details. So what does an urgent care do? Healthcare.gov calls an urgent care care for an illness, injury, or condition serious enough that a reasonable person would seek care right away, but not so severe it requires emergency room care. Like the services of a PCP provides, and may have additional in-facility services. These services are things like a lab and x-ray services. Urgent cares typically have longer hours than PCPs and are useful alternatives when your PCP is unavailable or closed. For example, you may not be able to get a same-day appointment with your PCP, or there may be a wait of a day or more. Cost is close to seeing a PCP, in some cases. Check with your insurance for specific details. And what's left but the emergency department, also known as the emergency room, ED, or ER? It's when you have an emergency medical condition. An emergency medical condition defined by healthcare.gov is an illness, injury, symptom, or condition so serious that a reasonable person would seek care right away to avoid severe harm. Emergency services usually will cost the most. Patients in the ER are triaged, meaning the most serious medical issues will be seen first. This means it can be a long wait if you do not have a life-threatening illness. Identify when one should go to a primary care provider, an urgent care, or an emergency department. When should you go to a PCP? Colds, fevers under 102 degrees, rashes, mental changes, health changes that are non-emergency care. For wellness exams and regular checkups, as well as illnesses like coughs, colds, flu, unexplained health changes that are not life-threatening, or to monitor known health problems. Before any medical treatment, your insurance may want you to see your PCP first. If you need to see a specialist, or if you need a referral. Some insurance policies require a referral from your PCP to see another doctor. Your PCP may direct you to another line of care, such as an urgent care or an ED. It may be because they are unable to get you an appointment, or your medical issues are more serious or life-threatening and need to escalate your care to another level. When should you go to an urgent care? When you cannot get in to see your primary care provider. Urgent cares typically have longer hours than your primary care providers and are useful alternatives when your primary care provider has no appointments open or is closed for the day. The same reasons as you would go to a primary care provider. Non-life-threatening health issues. Some broken bones of the hand, wrist, ankle, or foot. That is, if the injury is small. When should you go to the emergency department or the ED? If the PCP or the urgent care tells you to. For serious illnesses or emergencies, they may tell you to go straight to the emergency room. If a problem or illness is life-threatening or something you could die from, then go directly to the ED. For situations like chest pain, stroke, unable to breathe or when a person is not breathing, deep cuts or severe bleeding, head, neck, and spine injuries, seizures, poisoning or overdoses, passing out, and broken bones, especially if they break the skin, are just a few. If it is a situation that you need to call an ambulance or 911 for. Name one example each of a situation when one should go to a PCP, an urgent care, and an emergency department. In what situations should you go to a primary care provider? For non-life-threatening illnesses, such as coughs, cold, allergies, health changes, cuts, and small burns. For checkups, vaccinations, chronic illness maintenance. In what situations should you go to an urgent care? When you cannot get in to see your primary care provider. For many of the same reasons as you would see your PCP, non-life-threatening health issues, broken bones, and other minor injuries. In what situations should you go to the emergency department? In situations like having chest pain, stroke, unable to breathe, or when a person isn't breathing, deep cuts or severe bleeding, head, neck, and spine injuries, seizures, poisoning or overdoses, passing out, high fevers that do not get better with medicine, deep wounds, and serious burns. If it is a situation, you might call 911 or call for an ambulance. In these situations, please use 911 or call for an ambulance if it is needed.